Hello friends, this video series is for arterial disorder part 1. Question number 1 is which of the following is false for critical limb ischemia? Option A, AVPI more than zero point 0.9 is normal. Option B, AVPI less than zero point 0.3 is critical. Option C, causes are atherosclerosis and embolism. Option D, none of the above. Answer is D, none of the above. Explanation is critical limb ischemia, also known as chronic limb threatening ischemia, is the most severe and advanced stage of peripheral artery disease. It is caused by a significant blockage of the blood flow to the limbs, most commonly the legs and feet. An ankle brachial pressure index of less than zero point 0.4 is considered indicative of critical limb ischemia, a severe form of peripheral arterial disease. The diagnostic ratio calculated by dividing the systolic pressure in the ankle by the highest systolic blood pressure in the arm. सिंपल लैंग्वेज में क्रिटिकल लिम्ब इस्कीमिया का मतलब है कि लिम्ब की ब्लड सप्लाई इतनी कम हो चुकी है कि उसमें गैंग्रीनस चेंजेस स्टार्ट हो सकते हैं। तो उसके जो सिम्टम्स होते हैं उसमें रेस्ट पेन होता है, मतलब पेन रेस्ट की कंडीशन में भी पेन हो रहा है लिम्ब्स में, उसमें अल्सरेशन चेंजेस आ सकते हैं। तो उसके जो मेजर कॉजेज़ होते हैं वो एथेरोस्क्लेरोसिस होता है, बर्जर्स डिजीज़ होते हैं। ये क्रोनिक कंडीशन है एथेरोस्क्लेरोसिस बर्जर डिजीज़। एक्यूट कंडीशन में एम्बोलिज्म भी हो सकता है। थैंक यू। क्रिटिकल लिम्ब इस्कीमिया को डिफाइन करने के लिए हमने एक इंडेक्स वैल्यू बनाई है जिसको बोलते हैं एंकल ब्रेंकियल प्रेशर इंडेक्स। इसमें हम ब्रेंकियल अपर लिम्ब का ब्रेंकियल प्रेशर मेज़र करते हैं, एंकल में सिस्टोलिक ब्लड प्रेशर मेज़र करते हैं, और दोनों ब्रेंकियल ब्लड प्रेशर को एंकल सिस्टोलिक प्रेशर से डिवाइड कर देते हैं। अगर इसकी वैल्यू लेस देन 0.4 होती है तो द लिम्ब इज थ्रेटनिंग फॉर gangrenous changes. Question number 2. Which of the following is false for atherosclerosis? Option A, it is a chronic complex inflammatory condition. Option B, it is systemic segmental. Option C, it is known as Berger's disease. Option D, hypercholesterolemia is a risk factor. Answer is C. Explanation is atherosclerosis in peripheral arteries is the primary cause of peripheral artery disease, a circulatory condition that narrows arteries in the limbs and restricts blood flow. It is systemic process affecting the whole body and can also be segmental, meaning plaque circulation occurs in specific arterial locations such as the leg arteries, leading to narrowed blood flow. Hypercholesterolemia or a high cholesterol is a primary cause of atherosclerosis. Question number 3. Which of the following is false for Berger's disease? Option A, it is known as thromboangiitis obliterans. Option B, more common in lower limb than upper limb. Option C, it is segmental progressive occlusive. Option D, common in non-smokers than smokers. Answer is D. Explanation is Berger disease or thromboangiitis obliterans is a non-atherosclerotic progressive inflammatory disease characterized by segmental occlusion and inflammation of small and medium-sized arteries and veins, most commonly in the limbs. Berger disease affects both upper limb and lower limb, though it predominantly affects the lower extremities. It is more common in smokers. Question number 4. Which of the following is false for Raynaud's disease? Option A, it is episodic localized vasospasm of small vessels. Option B, color changes seen in sequential order are white, blue and red. Option C, often associated with CREST syndrome. Option D, also known as acrocyanosis. Answer is D. Raynaud's disease is a condition that causes the small blood vessels in the fingers and toes to narrow in response to cold temperature or stress. An attack or vasospasm can last about 15 minutes. The affected areas typically experience a sequence of color changes. White, reduced blood flow causes the skin to turn pale. Blue, the area may turn blue due to lack of oxygen. Red, as blood flow returns, the area may turn red and feel warm tightly or throb with pain. Other option like acrocyanosis. Acrocyanosis is a different condition. It is not associated with Raynaud's disease. So option D is false. Option C, often associated with CREST syndrome, is correct because Raynaud's phenomena is seen in CREST syndrome. Question number 5. Which of the following is false for reperfusion injury? Option A, myoglobinuria may occur. Option B, oxygen occurs due to oxygen-free radicals. Option C, it causes microvascular dysfunction. Option D, none of the above. Answer is D, none of the above. Reperfusion injury is a is tissue damage that occurs after blood flow and oxygen are restored in a tissue that was previously deprived of them due to ischemia. The sudden return of blood triggers process like the overproduction of reactive oxygen species and inflammation, which can paradoxically exacerbate the existing damage from the low oxygen period, leading to cellular dysfunction and death in the organs such as heart, brain, and kidney. सिंपल लैंग्वेज में रीपरफ्यूज़न इंजरी जब किसी ऑक्सीजन डिप्राइवेशन की कंडीशन के बाद जब दोबारा टिश्यू को ऑक्सीजन की सप्लाई हो रही है तो सेलुलर लेवल माइक्रोसेलुलर लेवल पे जो टिश्यू डैमेज हो रहा है उसके कारण जो इंजरी हो रही है और जो चेंजेस हो रहे हैं लाइक हाइपरकैलेमिया, फ्री रेडिकल इंजरी, रिएक्टिव ऑक्सीजन स्पीसीज इंजरी, इट कॉजेज डैमेज इन सम ऑर्गन्स लाइक हार्ट, ब्रेन एंड किडनी, that is called reperfusion injury.